Good afternoon. My name is Britt Earhart, a Public Information Officer for the County of Santa Clara Public Health Department. Here today to share some information about monkeypox. Pleased to have the chance to introduce Dr. Monica Roy. Dr. Roy is the Assistant Health Officer and Communicable Disease Controller for the Public Health Department. Dr. Roy?
Good afternoon. So we're here today to announce that we are currently investigating Santa Clara County's first probable case of monkeypox infection in a person who recently traveled internationally. The person preliminarily has tested positive for monkeypox virus after seeking medical care. The case was reported promptly to us here at the Public Health Department and is currently, the confirmation is currently pending testing at the CDC. This individual is in isolation, and the Public Health Department is following up with people with whom the individual may have had close contact with. Additional details about the individual will not be released for reasons of medical privacy, and I'm happy now to take any questions. So the test was positive at a laboratory that is able to test for both orthopox and monkeypox. However, the final step is confirmatory testing at the CDC. Within the next several days. Mm-hmm. Yes. So the CDC has identified three groups of people who are at higher risk. First, individuals who have had close contact with someone who is known to have monkeypox. The second is individuals with a history of international travel, particularly to countries where monkeypox has been reported. And then the third are people who are part of a social network that has experienced monkeypox activity. And so regionally, individuals who identify as gay, trans, or men who have sex with men are part of that group where we have been seeing a disproportionate number of cases. Yes, so all the Bay Area counties are working together to release messaging to make sure that some of the important public health messages are communicated. The key thing, I think, for the public as a whole to know is that the overall risk for monkeypox is low. The most important thing for people to do is if they have symptoms of a rash, particularly if they have a new partner, is to seek care from a medical provider as soon as possible. They may be tested not just for monkeypox, but other STDs, sexually transmitted diseases that are even much more common.
I was just going to ask you, what are some of the symptoms? How would you know that you've come into contact with someone like that?
Yeah, so monkeypox usually presents with, often historically has presented first with nonspecific flu-like symptoms, followed several days later by a rash. The rash for monkeypox is actually quite unique, and on the internet you can see lots of resources. We definitely would recommend looking at a trusted resource such as a public health department, the CDPH or the CDC, but providers have definitely been communicated with, and we are working closely with healthcare providers to make sure they know what that rash looks like. So at this time, we're not releasing detailed information, again, to protect the medical privacy of this individual, but we have been in contact and are following up with all the individuals that this person may have been in close contact with.
How long they were in the area, how long after they landed from international travel to when they found out that they had it?
So at this time, we're not sharing specific details. I will say that most of the clinical characteristics of this case all fit within what CDC and other health authorities have shared about kind of the typical incubation period and what we understand about the disease. So what I can share is that this facility has the ability to test for both monkeypox and orthopox. The person came and presented to care at that facility. A sample was collected on the 22nd, and then the positive test result was reported to us promptly, and therefore that's why we're here very quickly also notifying you and the public.
What should the population know in terms of transmission?
Yeah, so I think the most important thing to keep in mind is that overall the risk to the general population is low. Monkeypox is transmitted primarily through prolonged and close contact to someone who has active monkeypox lesions through direct skin-to-skin contact or contact with the lesions themselves or respiratory secretions from the infected person. But because it requires that prolonged close contact, overall for the general population, the risk of transmission is low. So no. At this time, what we're able to share is that this person does have a history of international travel. We do know with across globally that there are many countries that have reported monkeypox cases at this point.
What does testing look like, and where can a person go?
Yeah, so that's great. So currently, what generally happens is that providers, a healthcare provider who suspects monkeypox contacts the public health department, and we here in Santa Clara County in our public health lab have the ability to test. The state health department also has the ability to test, and so that is one mechanism. In order to increase access to testing, the CDC and the FDA are also supporting the development of assays by commercial entities as well as academic centers. And so we can anticipate, this week and in the coming weeks to see many more laboratories that will provide testing capacity for monkeypox.
So is the medical community just randomly testing people, or because we have this warning and concern, are they anyone who goes into the emergency room is being tested for this now?
Yeah, so that's a great question. So we have been communicating for many weeks now with healthcare providers on exactly kind of what to be looking out for. Healthcare providers should be suspicious of anyone coming in with a rash, but particularly those who have a history of international travel and amongst gay or bisexual men or men who have sex with men, that should increase kind of the suspicion or concern. But some of that messaging has been sent to healthcare providers so that they're aware and kind of on the alert when they do see patients coming in.
Does your smallpox vaccination cover this? Is this something you just go to the doctor's for today, or whatever? Should we update for this?
Great question. So at this time, there is not a recommendation if you do not have a history of close contact with a case to receive a vaccination, but this situation is evolving. We are working and communicating closely with the state as well as understanding some of the changes that we think may be coming from CDC. So it's possible that recommendation will change in the future. At this time, though, it is not recommended that community members at large seek vaccination.
Is there any possibility this would turn into a pandemic?
So because of the mode of transmission, CDC feels that the risk of transmission, particularly what we've seen in kind of pandemic potential, is much, much lower.
I guess my question would be, we've been through a lot in the last couple of years, and it just seems like every 6 months there's something else. Now, this may not turn into a pandemic, but what can we, expect? What can we do to try and get ready for what could be coming next? Because this kind of came out of nowhere, and I feel like 6 months from now there'll be something else.
Yeah, no doubt our communities and all of us have faced incredible hardships and kind of unexpected challenges in the last couple years. That goes without say. I think that we can expect with monkeypox while the pandemic potential is much lower, we do anticipate that we will see more cases. I think that the most important thing that we can do, there's I think probably two messages. One for the public is, making sure that you're having conversations when you have close contact with someone new or sexual contact, having a discussion about health status, including a discussion about any active rashes or sores. And if you do have any symptoms, making sure that you are staying home, seeking care from your provider as soon as possible, I think are the things that we would say for the public. For providers, it's making sure that they stay educated about the signs and symptoms of monkeypox so that when someone does come into their office, they're able to diagnose it very quickly and get that person isolated and taken care of. Yeah, so there is a treatment. It is primarily recommended, however, for high-risk individuals, people who are hospitalized, sick enough to be hospitalized. Thankfully, none of the cases that have occurred regionally have been sick enough to require inpatient hospitalization. Other risk groups include very young children or people with certain immunocompromised conditions. The treatment is really reserved for those individuals. So I don't think this individual case, really changes our concern or level. We were anticipating that we would be given how many cases have been seen globally in the U.S. and in the state of California. We anticipated that we would see a case. We do anticipate seeing more. But I think overall, we still believe that the risk of transmission to the overall community is low. Thank you.
Thank you all for coming. Ronnie, if we do have any late arrivals, we're happy to pop back out to accommodate them until 4:30. How nice to see you.